Welcome, ladies and gentlemen. My name is Rowan Petts, Executive Director here at the Australian Chamber of Commerce in South Korea. Earlier today, we did a webinar exploring Medtech innovation and collaboration between Australia and Korea, with a special case study from Cochlear. This is the highlights version of that, featuring Jason Chai, Director, Market Access and Government Affairs at Cochlear APAC, and Stephanie Yoon, General Manager at Cochlear Korea. If you would like to watch the full version of this webinar, be sure to check out AustCham on YouTube, LinkedIn, Facebook, and on our website. Thank you very much.
And that is what Cochlear does. Cochlear is a global leader in implantable hearing solutions with products including cochlear implants, bone conduction implants, and osseointegrated steady-state implants. And since 1981, Cochlear has provided more than 600,000 implantable devices, helping recipients of all ages in more than 180 countries to hear and live full and active lives. Whether these hearing solutions were implanted today or many years ago, Cochlear strives to continuously develop new technology and innovations for all our recipients. Today, I'll be outlining for you how Cochlear seeks to engage with global players, and in particular overseas governments, around Cochlear's comprehensive hearing implant portfolio. Ruslan's already provided you an outline in terms of what happens in South Korea, but noting the fact that the audience will come from not only South Korea, but also Australia, and there are different objectives. I'll give you a more high-level kind of framework in terms of how you communicate value to a government payer, and from that, use Cochlear as an example. And through this value framework, we'll discuss how to build an evidence-based kind of approach to conveying that value. While most markets will rely on private market for customers, it's important not to forget the government payer, which is the single largest payer in every market. The first step in building value is to define the therapy area and identify as accurately as possible the prevalence data that define disease or disability. Now, according to the World Health Organization, today 1 in 6 people are thought to have hearing disability globally. Globally, more than 1.5 billion people experience some decline in their hearing capacity during their life course, of whom at least 430 million will require care. Loss of hearing, if not identified and addressed, can have far-reaching consequences, adversely affecting language development, psychosocial well-being, quality of life, educational attainment, and economic independence at various stages of their lives. Unaddressed, hearing loss imposes a global cost of more than $980 billion annually. Defining value for government payer is understanding the target population. While the prevalence data for the disease area is important to defining the therapy, it is the target area which is important to help government payers know what the exact size of the population is for your specific medical device. For cochlear implants, it is people with severe and profound sensorineural hearing loss, broken down by adults and children. To give you context, profound hearing loss is standing next to a jet engine and not being able to hear it. In South Korea, around 356,000 people have severe to profound sensorineural hearing loss. And this group is divided up between adults and children, where there are different reimbursement rules depending on the specific target population. Stephanie will go into a little more detail about our business in Korea, but I want to highlight at this point that in South Korea, 39% of pediatric recipients are implanted bilaterally. That is, they receive a cochlear implant on both sides of the ears if they have hearing loss in both ears. While only 5% of adults recipients are implanted bilaterally when they have hearing loss in both ears. That disparity comes down to one cause, and that's government reimbursement. In Korea, the government subsidizes children implants, while they don't subsidize adults. I'll have a little bit more to say on that, so just hold that thought for the time being. Governments need help to identify the unmet need. Or put another way, governments need to help to identify solutions, particularly technological ones, to assist them to addressing their society's problems. Cochlear implant is the only solution to the unmet need of congenital sensorineural hearing loss. Children born with congenital sensorineural hearing loss have major adverse development and health impacts on children's lives, including speech and language, literacy, mental health, social and cognitive functioning, educational achievement, and employment and socioeconomic opportunity. Society is structured around the senses of hearing and speech. And if a person can't communicate with these, they need to access special education through other means like sign language. Cochlear implants meet the unmet need of restoring hearing to those that are born with no hearing at all, and give that person the ability to hear and when rehabilitated to be able to attain the educational development that leads to more economic employment and socioeconomic opportunity. After establishing the unmet need, your medical device needs to demonstrate that it is a standard of care. You need to demonstrate that technology is safe and delivers superior clinical benefit. For Cochlear, it was demonstrated that early intervention delivers superior educational outcomes. In Australia, Macquarie University undertook a landmark study called the Longitudinal Outcomes of Children and Hearing Impairment, also known as the LOCHI study. The LOCHI study is a population-based longitudinal study that prospectively evaluates the development of a group of Australian children with hearing loss as they grow up. This study is unique in its inclusion of children whose hearing loss was diagnosed through the universal newborn hearing screening, which many of you will know if you've ever visited a hospital when a newborn has been born. The study asked the following research questions. Does universal newborn hearing screening and early intervention improve the outcomes of children with hearing loss at a population level? What factors influence the outcomes of children with hearing loss? And can early performance predict later outcomes of children with hearing loss? It found that early intervention commencing by 6 months of age results in optimal speech and language development and reduces the need for ongoing special education. Early intervention was found to improve the well-being of families with children who are deaf and to facilitate diagnosis of any additional disabilities. Early intervention is linked to better preschool language development. And once you can establish a clinical benefit, you need to demonstrate to the government pay the incremental benefit of your intervention versus not doing anything. And this could be measured in terms of individual and societal benefit, although health technology agencies often discount societal benefit. To demonstrate this, I'd like to tell you a little bit more about a study delivered by an organization in Australia called First Voice. And in this First Voice study, 3 in 5 hearing impaired children who received early intervention go on to achieve a tertiary level of qualification, whereas 95 of the auditory verbal therapy graduates from this First Voice study with cochlear implants were heading to mainstream schools. This reduces the need to build more specialist deaf schools at high school and enables cochlear implanted children to be able to participate in learning along with their peers. And once you're able to demonstrate the value of the therapy, you're very close to being able to argue your case for your medical device to be reimbursed. The most critical step is being able to demonstrate the value of the therapy relative to the costs of not treating the disease or disability in the case of hearing loss. Under this First Voice study, the research demonstrated an estimated saving of around $60,000 in avoided school costs achieved through childhood participation in early intervention therapy. For every dollar invested in AVT, early intervention program, there is a $2.20 return on investments, and these include well-being, economic gains, and financial benefits. So the last step is being able to communicate all of the above to the government payer and persuading them to accept your proposed price for the device. And in proposing a price, you need to consider a range of factors, including what factors that particular government is likely to consider around the problem. To demonstrate this, I wanted to, highlight this particular graph and break down the archetypes. On each of the axes, you have value versus costs. That is, value is where people are willing to pay more, whereas costs are people are willing to pay, payers who are willing to pay less. And then on the vertical axis, you have product effectiveness, that is the technology and the effectiveness at addressing that particular disease and disability. And on the other side, you have budget considerations. Now, sprawled on these axes are a number of different countries, but if you had to break them down, you could basically break them down into four major archetypes. The first is, the group called the clinical effectiveness archetype. Basically, countries who highly value technological innovation and will pay for innovation where it's above the standard of care. The next is the cost effectiveness group. Within the first group, you'll see countries like France, the Netherlands, Germany, and Japan. The second group is the cost effectiveness group, which is basically trying to do a compromise between cost, but also product effectiveness. And in that bracket, you have countries like Australia, like the United Kingdom, Canada, Sweden, Singapore, and South Korea probably sits in that quadrant. In the third quadrant, you have decentralization and budget optimization archetypes. Basically, countries which are very conscious about price, and they will be very conscious about exactly what price they're paying. And they, as you can see, Brazil, India, China fit inside that kind of quadrant. And the key drivers for them is, how do I deliver the most the most health benefit for the least amount of price? So budget considerations are really important. And then on the the last quadrant, the free private market, it's basically the United States, being a private market where the health insurer is negotiating prices with the medical device company constantly. They will pay for both value and they'll be very conscious about budgets in the sense that they'll constantly redefine where the price point should be. But if you have a sense of which country you're going into, you'll have a better sense of exactly which arguments will resonate with them most. So in a country like Australia, you really need to demonstrate and present the evidence for cost effectiveness, whereas in a country like South Korea, you really need to demonstrate the product effectiveness and the technological innovation that you're bringing. And lastly, this is a comparison of how different regimes have treated cochlear implants to date. You'll see in cascading order, Australia down to Malaysia, and whereas Australia has the most available patient access for patients with sensorineural hearing loss, that's broken down into children, adults, and then broken down to reimbursement regimes, both for the bilateral processor but also the sound processor. And for Australia, it's relatively good. In fact, it's probably the best in the world. It's the ecosystem which is most supportive of assisting people who have severe to profound hearing loss. As you go down the scale, you'll see that Japan and South Korea are very, very similar. But I guess the key difference is that Japan, the key similarity is that Japan and Korea both have excellent reimbursement regimes and have universal healthcare. But the one area of difference is where bilateral implantation for adults is not yet available in South Korea. And that comes down to a range of different factors. And a range of that comes down to how the public policy discussion happens around those four axes I was talking about. But I hope that gives you a capture exactly how cochlear implants fits within the government payer system. I'll now hand over to my colleague, Stephanie Yoon, who will then go into a little bit more detail about our business in South Korea.
Before we go any further, please allow me to introduce myself. My name is Stephanie. I've been working for Cochlear Korea as a general manager since June 2018. It's my great honor to present about CI business in Korea market to all of you. Thank you for taking time out of your busy schedule. The topic of my presentation today is bringing Australia's hearing technology innovation to Korea. The presentation has three main sections. Firstly, I will brief about cochlear implant market overview, including demographical trend and market potential. Let me walk you through key growth factors. Lastly, I will come up with our future focus. I will begin by population in Korea. Korea is one of countries decreasing birth rate significantly year by year. Historically, conventional CI surgery cases generated from children, especially from having congenital profound hearing loss. However, with decreasing birth rate, children's CI cases expected to be declined eventually. On the other hand, with entering a super aging society, senior ratio age over 60 years old increased up to 24% out of total population. With this market trend, we are focusing on increasing awareness about CI surgery versus hearing aid for adult patients. Typically, senior patients know about hearing aid, but have low level of acknowledgement about cochlear implantation. Almost half of population lives in Seoul and metropolitan area. Naturally, more than 70% CI business volume generating from metropolitan city. We are living in an era of 100 years old life cycle. Before time, senior patients were afraid of taking CI surgery, even if they are diagnosed sudden hearing loss after age 60-something, mainly due to two reasons. The one is that they may have certain years remain only to live. Surgery cost is a big burden for them considering their residual life. Another reason is that they don't want to give an economic burden to their sons and daughters. However, nowadays, senior patients treat their hearing loss actively, mainly because of long life expectancy and high relevance between hearing loss and dementia. Major scientific journal published many articles related with hearing loss, and it is proven that untreated hearing loss increase the possibility of dementia 5 times higher. Once we look at the market potential, according to Health Insurance Review Agency data, detected severe profound hearing loss patients are 135,000, which shows 40% out of total number of hearing loss people. Annual total market coverage shows only around 0.5%, which means a huge market potential out there. Let's move on to the following stage of the presentation, growth factors. First of all, innovative technology is our core competency, which make us differentiate from competitors. Our product has all those 5 innovative features, which put ourselves in a dominant position in the marketplace and made us possible to be the global #1 player. Secondly, Cochlear Korea increased brand awareness through various kinds of media channels over the last 3 years. In order to inform about our products to surgeons and recipients, educational support are the major activities of Cochlear Korea and main trigger to build our business. Last but not least, after pandemic outbreak, we operated Cochlear Care vehicle to visit each customer who asked us to provide free trial service for new products. While people are reluctant to travel or take public transportation, we visited our customers with company car regardless of region nationwide. The best strategy for us to build a business is let customer feel the difference by free trial of our products. Let's move on to the last slide. We will continuously work on raising awareness about cochlear implants through introducing innovative technology with our products. Educational support is our key success factor for our continuous business growth. Most of all, as Jason highlighted in previous presentation, Cochlear Korea will make every effort to implement reimbursement policy about bilateral hearing, especially for adult patients. Please have a look, 1-minute video.
It listens for the tiny sounds of its prey moving about below, but must take great care not to scare them away.
It shows clearly how much it is crucial to hear with both ears, not only for hearing itself, but also it affects directional ability. Without seeing the object, the fox attack exactly the target. If this fox has 1 ear, he will starve with not able to hunt any food during the winter. To sum up my presentation today, Cochlear Korea, as a #1 company in CI industry, we will try our best to be a lifelong hearing partner with innovative technology and value-added service continuously.